as a chief executive for the acceleration of the stunting reduction. To implement this, BKKBN has recruit about 200,000 team. We call the family a component team. Every team is 3 person. It means kader, ibu PKK, and midwife. There will be a company, all of the spouse who will get married, and all of the pregnant women until first 1,000 days of the life. The family companion will be contribute to detect the risk of the stunting before, during pregnant, do the educated for the mother and family, eliminating all the harmful practice, and also motivated all of the pregnant mother to use the postpartum contraceptive by target 70%. By this, we hope it will be help to decrease the number of the unwanted pregnant mother. Ladies and gentlemen, the most important thing make this program is success one. We need really collaboration from one another. And the end of my speech, by permission from all of you, let me open this webinar by speak basmalah. Bismillahirrahmanirrahim. Thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh. Sawasdi.
Ya, waalaikumsalam warahmatullahi wabarakatuh. Terima kasih banyak Ibu Eni atas open remarks-nya juga ya dari Ibu Eni keynote speech-nya. Benar sekali, ini fakta ya Rizka ya, ketika tadi data yang ditampilkan oleh Ibu Eni, adanya kenaikan kehamilan tidak diinginkan ya dari 17% menjadi 23%. Wow gitu ya, dan itu sangat berefek juga kepada stunting tentunya.
Benar
gitu.
sekali, Owa.
Ya, ketika seorang muda gitu ya, yang masih belum, kita tadi sempat berbicara tentang ini ya, dalam usia muda untuk mengalami kehamilan, yang mungkin ya organ reproduksinya itu belum kuat atau belum siap lah belum siap untuk mengalami untuk ada janin di dalamnya, sehingga ya itu tadi gitu, sehingga janinnya juga tidak dapat berkembang dengan baik, sempurna. Sehingga salah satunya faktor yang juga terjadi itu adalah tingginya juga angka stunting ya di Indonesia, bahkan di wilayah-wilayah yang itu tidak juga gizi buruk gitu ya, nggak semuanya di gizi buruk gitu, tapi angka stuntingnya cukup tinggi. Baik, terima kasih banyak Ibu Eni, dan selanjutnya ini kita welcome to main session, dialog interaktif with 3 speakers, and will arranged by our beautiful moderator Vita Rizky Utami, who a person very concerned on SRHR issue and working on it more than 13 years.
13 years, sangat
also,
lama ya.
Yeah, and also graduated from Faculty of Medicine, Lund University, Swedia. Ini majoritinya dia itu tentang sexual and reproductive health and rights, health economics and health system, health policy, health promotion, planning and leadership, quantitative research, epidemiology and biostatic. Luar biasa sekali.
Luar biasa sekali. Dan memang kawan kita Vita ini sudah malah melintang di dunia HKSR dan juga lulusan dari Lund University, Master of Public Health. Ya, itu yang saja yang bisa saya perkenalkan kepada teman saya Vita ini. Untuk selanjutnya bisa diserahkan kepada Vita untuk memandu acara sebagai moderator dalam kegiatan kita di pagi hari ini yang berjudul apa, Wak?
Ya, judulnya tentang Policy Direction and Global Challenge Related Unwanted Pregnancy. Kepada Vita, time is yours.
Silakan Vita.
Oke, terima kasih Owa dan Riris. Suara saya jelas ya?
Jelas sekali, dan terlihat cantik juga ya di kamera ya.
Iya, luar biasa loh.
Cuma di kamera, tapi aslinya ya biasa-biasa aja. Good morning, everyone. I would like to express my gratitude to be here with all of you, and I would like to say hi for everyone from the IPPA Indonesia. Also, I would like to say welcome to Bu Eni. It's been a long time since the last time we met. very happy to see you here, happy and healthy. Also, the chair of IPPA, vice chair, and also the secretary of the IPPA, and of course the executive director of the IPPA. So I will be moderating the session for the next 2 hours. Do we have 2 hours? I think so. We already have great panelists here with us, great women, great activists, very vocal, very inspiring to be here with us in a very special moment to celebrate the birthday of IPPA, but also the Women's Day in Indonesia. So we have 3 people in the panelists this morning who will share with us about important topics that are very close to our hearts, which is about unintended pregnancy. How is the current trends? What are the challenges of women's understanding the impact of COVID pandemics for the past 2 years? And what are the opportunities and how the civil society have been able to transform the challenges making into opportunities instead of barriers to really meet the demands of the rights of women especially in Indonesia, but also in the region. Yeah, so we have Alexandra. I will start with Alexandra. Unfortunately, we don't have one of the panelists wouldn't be able to join us, although she will actually give an perspective of the global current trends on unintended pregnancy situations. But here we have also Alexandra. Alexandra is the Executive Director of Asia Pacific Alliance for Sexual and Reproductive Health and Rights. She's joining us from Bangkok, if I'm not mistaken. Alexandra?
Yes, that's right. Hi.
Hi, welcome. Nice to have you here in the sessions. So APA's mission is to hold governments in the Asia Pacific to their obligation on sexual health and reproductive rights, and to ensure that marginalized communities have a voice in shaping the laws that affect them. So in this dialogue, she will share with us the experience of women having unintended pregnancy, facing structural challenges, which is exacerbated by the COVID pandemics. So Alexandra, can you share with us your deep analysis on the current challenges facing by women and how we have identified the crack in the systems, which has been there a long time ago, but it's getting bigger and it's more visible because of the pandemic. Please, Alex.
Thank you so much. And I just want to say I'm very happy to be here today. So thank you for inviting me to be part of the celebration. And I'm really excited to see so many different faces and so many different people from around the country that are able to attend today. So allow me to just share my screen. Yeah, so I will be speaking today a bit about how to advocate for safe abortion, some of the opportunities and some of the challenges. I also feel that because everybody here probably knows so much already about the challenges, I wanted to open it up a little bit and talk about where some of the opportunities are in the next couple of years. I work with the Asia Pacific Alliance for Sexual and Reproductive Health and Rights. We are a regional network that is based in Bangkok, Thailand. We have about 40 members from around the region, and IPPA has been a member of the network for several years now. We work mainly on regional advocacy and capacity enhancing around advocacy. So just some very quick stats. Unsafe abortion is really driven by inequality. Asia has the highest unsafe abortion rate in the world right now. 97% of unsafe abortion happen in developing countries, so there's quite a bit of disparity there. And also women living in rural areas, women with disabilities, and other marginalized groups are disproportionately affected by unsafe abortion and limited access to abortion services and contraception. There's some good examples from the last few years from Asia and the Pacific, which is quite exciting. Several countries have decriminalized abortion over the last 2 years. New Zealand in 2020, removed abortion from their Crimes Act, and now it's in their health policy, and they allow termination of pregnancy up to 20 weeks. South Korea this year also decriminalized abortion. Thailand, where I am based this year, it was very exciting. They decriminalized abortion up to 12 weeks. And in India, they also amended their act, and abortion can be performed up to 24 weeks. So there's lots of good examples around the region.
Juga akan ada kegiatan, tentunya itu akan ada kegiatan online juga nih Rizka. Ya,
excuse me, can someone who is not speaking for the mic for a little bit so Alexandra can continue?
Di Zoom udah mulai.
There are three main sort of tenets to ensuring an enabling environment. One is respect for human rights and a supportive framework for law and policy. Second is availability and accessibility of information and education. And having a supportive university accessible well-funded health system. It's also predicated on autonomy, which is of course enshrined in a lot of international agreements that Indonesia has signed on to. This includes the ICPD, which is the International Conference on Population and Development, CEDAW, the Beijing Platform for Action, and CESCR. So bodily autonomy encompasses many different rights, including right to health, right to life, right to information, freedom from torture. SRHR, the definition of SRHR includes the ability to freely define your sexuality and express sexual orientation and gender identity. It talks about deciding whether and when you can be sexually active, having the ability to make those choices for yourself and to choose your own sexual partners, to decide when, whether and whom to marry, whether to have children, when and how many. And of course, the right to SRHR includes access to information, education, and services. And those services, as pointed out by the first person who is speaking today, should be accessible and appropriate for marginalized communities and young people so that they truly are accessible. Some of the challenges around having a restrictive legal and policy environment, of course, are that it criminalizes what should be a health procedure. So it makes something illegal, which is actually something which is about health. These include things like time limits to access abortion, mandatory waiting periods, providing biased information, so information that is not true. Things like needing spousal consent or parental consent, and the refusal of health workers to provide abortion based on religious belief or personal conscience. So all of this really exacerbates inequalities in a country, and they deny human rights of women and girls. Some of the major challenges are that opposition to safe and legal abortion is political and cultural. It's not technical or financial. So we know how to solve the problem, but there's political opposition and strong beliefs that are stopping it. It's not about money. There's a lot of stigma around abortion. There's stigma for people who are seeking abortions, but there's also stigma around those who are providing the services, which also prevents a barrier. It makes it difficult to collect accurate information. And so that accurate information can make policymaking a bit more difficult. There's patriarchal values, of course, which devalue women and girls, and deny their bodily autonomy. And again, inequity is affected by already existing gender, race, economic status, and healthcare, which disproportionately affect marginalized groups in society. The impacts of restrictive laws are, of course, the first one that we know about is maternal mortality ratio, MMR. Unsafe abortion is a leading cause of preventable maternal mortality. It's higher, we know that it's higher in countries that have a restrictive legal and policy context. Right now, maternal mortality ratio is 177 per 100,000 live births, which is actually, it's decreased a lot in the last decade It used to be much higher in Indonesia, but it is still quite high in the region. I think it's the highest in Southeast Asia. And just to give you a reference, the sort of global target, all the countries, the target for all countries to reach is 70. So right now, Indonesia still has some work to do. There's many long-term impacts. One is around education levels. Women who are forced to carry a pregnancy, an unwanted pregnancy, have to drop out of school. They are not able to get access some skilled employment opportunities, which has a long-term effect on the growth of the country as well. So it ends up affecting GDP growth. There's also costs to the health system. So complications from unsafe abortions, of course, are very costly. And in developing countries, there's an estimate that they cost every year $553 million US dollars, which is a lot that could be saved just by providing access to information and services for all. Now I will just talk about a few of the opportunities for advocates who work on this issue. And because I work at regional level and global level, I will talk about those that are those processes and agreements that Indonesia has signed on to at the global and regional level. Some of the most important opportunities that are coming up next year, which I will go into a little bit more detail, but Indonesia will be undergoing universal periodic review next year, which is a really important opportunity for civil society and organizations such as IPA to put a report together, and you can submit it to the review process. There's also it's called the Asia Pacific Population Conference. It's an ICPD review at the regional level that will be happening in 2023. There's a meeting on universal health coverage in 2023. And of course, there's Agenda 2030. Indonesia has already reported twice through that process, I think 2017 and 2019. And so they will most likely, we don't know yet exactly which year, but most likely will be reporting again soon. So in terms of international human rights mechanisms, Indonesia has signed on to many of these. They've signed on to CEDAW, which is important for women's rights. And in fact, the concluding recommendations have been given to Indonesia for, I think, 3 years, the most recent in 2021. And they highlight, one of the main recommendations coming out from that body was improving the coverage and access to health services, including and intensifying efforts to reduce maternal mortality, and extending the time limit to undergo abortion and legalizing abortion in cases of incest and rape and threats to life, as well as they recommend decriminalizing it in all cases. So it should be removed from the penal code and just put into the health policy altogether. Some other ones that I won't talk so much about are the CRC, which is the rights of the child, or SESCR. There's also special procedures. So the special rapporteur came to visit, the special rapporteur on the right to health came to visit Indonesia in 2017, made a country visit and formed a report on all kinds of human rights violations. And that's important because for a special rapporteur to visit a country and to produce a report, they have to be invited by the country. They can't just show up. You know, the government has to allow them to come in and to assess things. And so the special rapporteur in 2017 also made quite a few recommendations, strong recommendations around increasing access to health services, decreasing maternal mortality, and ensuring access to safe and legal abortion. So the first opportunity that's coming up very quickly is called the Universal Periodic Review. And I just wanted to share a little bit about it because it's quite unique. It is a state-to-state peer, that's what peer review, what I mean by peer review means states are reviewing states. Indonesia right now is on the Human Rights Council. And so they participate in these reviews. All member states, so every state in the world, is reviewed every 4.5 years. And Indonesia has already been reviewed several times. and will be reviewed again in 2021. So why is this important? Because this is a mechanism that has been set up by governments to improve directly to improve the human rights situation on the ground. It encourages sharing best practices among states. It encourages full cooperation, but what also is important is that it is state reviewing states. So it actually it carries a lot of weight with member states. The recommendations coming out of these reviews, governments pay a lot of attention to them. And for sexual and reproductive health and rights broadly, UPR has been a very valuable mechanism since its inception. Action on recommendations related to sexual and reproductive health and rights have been implemented mainly, like at 75%, which is higher than recommendations on other issues. Civil society can submit, as I said, they can gather evidence and submit stakeholder reports directly to the review process, which then get considered by the member states. They also have the opportunity to make a statement during the review, and they can work with other governments. So in your report, you provide several recommendations, and you can work with other governments to try and build support for your recommendations. So during the review, they will actually say to Indonesia, look, we think you need to do this. We need to work on access to contraception, for example. Yeah, I think we can skip this. As I said, the recommendations around sexual and reproductive health and rights have been increasing. So they're quite a high number of the recommendations coming out of UPRs are around SRHR, which is what makes it so valuable for advocates. The other one that I think probably most people have already heard about is Agenda 2030. This is also something that all governments have signed on to, and Indonesia has reported twice already, 2017, 2019, and will likely do so in the near future. These reviews only the countries sign up only 1 year in advance. So we have to keep an eye out every year to see when they sign up again. But there's 17 sustainable development goals altogether, but there are 2 that are very, very important for SRHR. One is SDG 3, which is ensuring healthy lives. And there we have a target to reduce the global maternal mortality ratio by 2030. We also have another target to ensure universal access to SRH services for family planning, information, and education, and to integrate reproductive health into national strategies and programs. The other SDG that I wanted to highlight that's very important for people to know about is SDG 5, which is achieving gender equality and empowering all women. So here we have a target that talks about ending discrimination, all forms of discrimination against women and girls, which includes discrimination in accessing health services, for example. It includes ending all forms of violence against women and girls, eliminating forced marriages and FGM. And of course, we have another one around universal access to reproductive rights. So all of these are important. And again, during the reviews, there is an opportunity for civil society and organizations to provide alternative reports to what the real situation is in the country and have that presented. It's also very important for you as advocates to take a look at what Indonesia has put in their country reports to see if you agree, to see if it agrees with the reality that you are working in and living in right now. The third one that I wanted to talk about today is the International Conference on Population and Development, which I think probably many people are familiar with. The ICPD, as we call it, was passed in 1994. And it was really important at the time because it was the first major intergovernmental document to link human rights and sustainable development. And it affirms really the importance of sexual and reproductive health and rights as a condition for empowering women. It contains very specific guidance around things like adolescent sexual health, prevention of unsafe abortion, reproductive rights. It also talks about how important it is for governments to work with civil society. And it is reviewed every year at something called the Commission on Population and Development. The reason I am highlighting it today is because the ICPD will also be reviewed at the regional level. So that means all governments in Asia Pacific will gather, and this will happen in 2 years, to discuss progress that has been made on these commitments contained within the ICPD. We have our own agreement at the regional level called the Asia Pacific Ministerial Declaration on Population and Development. And it's a very strong, very important document for us to know about, because it contains a lot of language, a lot of progressive language, and some that is stronger than the ICPD itself. It contains language around accessing abortion services. So I've listed here, if you see the paragraph numbers, which talk about
recording in progress.
It contains a lot of strong language, again, around other SRHR issues which are linked and important, like comprehensive sexuality education, HIV, marginalized groups. What we should know also is that last year, what was passed to measure progress on the ministerial declaration, and a regional indicator framework was passed by all governments, including Indonesia, at the SCAP Commission on Social Development. So this means that governments in our region, for the first time, will be reporting on this indicator framework in 2023. And the guidance for governments, they will be advised to work with civil society, to work with important organizations that are working on sexual and reproductive health and rights, like EPA. The guidance will include recommendation for governments to work with civil society in collecting information and data for the reports. So it's important that you reach out to either UNFPA or the government to find out when they will be having some of these meetings to talk about it, so that you can inform the process. And this is expected to come out, I think, if it hasn't already, it should be coming out early next year. It includes specific indicators, again, like similar to Agenda 2030. It contains indicators around inclusion of SRHR in laws and regulations, maternal mortality ratio, and the proportion of women who make their own informed decisions regarding sexual relations, contraceptive use, and reproductive health care. Beijing Platform for Action is also important for SRHR activists. I will only highlight last year, there was something called the Generation Equality Forum, which was a huge global meeting, which happened, I think it was in July. And it was a multi-stakeholder process. So there were many governments took part, but a lot of private sector and a lot of civil society. And what is important is that there is a whole action coalition on bodily autonomy and SRHR. And they have made several big commitments around the topic towards expanding comprehensive sexuality education, increasing abortion services and access to contraception, increasing decision-making and bodily autonomy. There is a lot of money that has been committed to doing this. So for Generation Equality Forum, there are one action coalition is bodily autonomy. There are 6 altogether. But there is around 40 billion that has been committed by governments, by private sector. It's a lot of money that's been committed to helping achieve all of these commitments. So it's important for us to keep an eye on it. It has not really started to be implemented yet, and they are still working on the accountability framework. But it's a very important, it's a very important forum for us to be aware of, and also to maybe encourage Indonesia government to make commitments to this as well. My last interesting issue that I wanted to talk about is universal health coverage, because it is a very it's a very important issue for SRHR advocates. There is a high-level meeting that happened on UHC a couple of years ago, and there is another one that will happen in 2023. What's important about the 2023 HLM, it's called, is that they will be looking at the impacts of COVID-19 on universal healthcare. Again, this The political declaration highlights ICPD in Beijing and Agenda 2030, which I have just been talking about. And Indonesia has also made an FB 2020 commitment, a very strong commitment to FB 2020, which includes the commitment to achieving universal healthcare. Coming out of COVID-19, what we have found is that it's really, I mean, we know that there were so many barriers to SRHR during COVID-19. Women couldn't access services. They couldn't access information. They couldn't yet take care of themselves. So what has really come out of this pandemic is the importance of self-care. The importance of self-care to achieving and strengthening health systems and empowering people to be able to make decisions over their own health, especially marginalized communities. I think that there is someone here from Women on Waves in the participant list, and this is something that Women on Waves, the organization, started working on many years ago. They were quite a pioneer in this, but now SRHR self-care is becoming much more important, and we're finding good practices from all over the region, especially during COVID. So these good practices can be things like using telehealth for access to abortion and access to contraception. It can be using things like digital health information, using apps for young people to find information around SRHR. It also includes things like self-testing for HIV and STI. There's a lot of really great initiatives going on, and I actually have in the corner here, it's a picture. APA has put together a small toolkit which gives these examples from around, specific examples from around the region on this. So if anyone is interested, they can take a quick look. But I would also, so what I also wanted to highlight or ask the group that are listening today to think about is if they know of any good examples already in Indonesia, because in our toolkit, we don't have an example from Indonesia yet. So I'd be very interested to find, and maybe we could add it if people know of some good examples of SRHR self-care. And I think from there, I will just say thank you very much. And yeah, please let me know and contact me if you have questions.
All right, thank you, Alexa. Such a very comprehensive analysis of the current situations, the global overview of the unintended pregnancy situations, but also, as you mentioned, challenges can also be transformative opportunities, right? If we really grab that moment. As we know, unintended pregnancy itself it's symptoms. It's rooted from different problems in the society, like you mentioned, it's political issues. It's coming from the cultural aspect of the society, religious interpretations that is not supporting women's rights, also policies by the government that should hopefully be met with the actual needs of women's understanding the complications and challenges of being women in that specific countries or contexts. You also mentioned a lot of opportunities at the different UN system and mechanisms that we can use. Although, again, we have to identify where we pick the battles, right? Where we pick our strategies. Some of us may not focusing on the advocacy strategy. It's very important, but also we have to remember there are some other strategies we should not leave behind. For example, community organizations, providing services. And this is also a very big role of civil society to really meet the crack in the systems that cannot be filled by the government's roles. So therefore, I would like to introduce to the next speaker, Ibu Josephine. Ibu Josephine is the Honorary Secretary of the IPPA Indonesia. She would like to be called as Ibu Koko. So Ibu Koko would like to share the insights from the IPPA experiences and how the civil society has playing a significant roles in meeting the demands and the needs of women and girls in Indonesia when it comes to SRH services, especially unintended pregnancy. What are the lessons learned and what can we improve as part of this big movement and solidarity to really have everyone with their own power to really work together and really work the best for the interests of the women and girls. Ibu Koko is joining us from Bintaro, it's the southern Tangerang of Indonesia. Ibu,
Terima kasih Mbak Vita.
this is yours.
Ya, terima kasih. Selamat pagi Bapak dan Ibu semua. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua. Om Santi Santi Om, Namo Buddhaya. Bapak dan Ibu sekalian, izinkan saya untuk menyampaikan paparan saya dengan langsung presentation mode aja saya. Ya, oke. Dengan menggunakan bahasa Inggris tapi pakai logat ya, semoga interpreter yang sudah disediakan tidak mengalami kesulitan untuk menerjemahkannya. Baik, dear friends and colleagues, it is such an honor for me to be here on this important occasion of commemorating bisa di-mute mungkin, maaf. Bapak Ibu tolong di-mute, oke. 64 years of establishments of IPPA. Thank you so much for the support from the BKKBN and also IPPF on this long journey. 64 years is not a short period. Somehow we are still learning, and also with all the challenges in the last 2 years during this pandemic time, IPPA as the eldest civil society in Indonesia would like to share some of its experiences in dealing with unwanted pregnancies in Indonesia. As mentioned by Pak Iksan, our chairman in his opening remarks, that this issues is a very serious issues in Indonesia. As we all know, there are lots of unwanted pregnancies incidents in the world. As Pak Jamil mentioned, that this is a social issues based on the data collected from Indonesia Demographic and Health Survey in 2017, that for the last 5 years, the unintended pregnancies contribute to that 16% of the total pregnancies, where 8% falls into the category of missed time pregnancies, and the same percentage also applied to the yang sebelumnya Mbak, sorry, unintended pregnancies, thank you. Applied to the unwanted pregnancies. And even data collected by WHO from 2010 to 2014, the number of unintended pregnancies in Indonesia is one of the highest in Asia. This also stated by Ibu Alexandra in her presentation. For the case of Indonesia, out of the 34 provinces in Indonesia, the number of unintended pregnancies in 14 provinces, such as all provinces in Java Island and Riau, Kalimantan Timur, Bangka, West Papua, are higher than the national number. Based on IPPA data, it was found that for the last 10 years, more than 20 clients daily came to our clinics with the case of unintended pregnancies. The variables of maternal age, number of living children, use of contraception, marital status, area of residence, and mother education significantly affected the number of unintended pregnancies in Indonesia. For the missed time pregnancy, it was found that the number is higher for the high schoolers. Meanwhile, the tendency for unwanted pregnancies were higher for women above 35 years old, had at least 3 children, use contraception, unmarried, live in urban areas, with junior or high school educational background. Okay, next slide, Mbak. Next slide, please. Okay, yeah, thank you. If we look further, we can find reasons and causes of the unintended pregnancies. According to the late Dr. Kartono, one of the prominent IPPA figures in Indonesia, it can be classified as the cause and type of pregnancy, condition of the babies, marital status, or contraceptive failure. Whereas the data collected by IPPA in 2017, most of the reasons are sufficient number of children or age of the previous child. Next slide. The number of unwanted pregnancies are suspected to be increasing during this pandemic time. Based on the data by BKKBN, these unwanted pregnancies contribute to 75% of maternal mortality. Another data also shown, yang tadi Mbak, okay, women with, terima kasih. Another data also shown that more than 2 million women had to go through the unsafe abortion in Indonesia. And we believe that this number is only the tip of an iceberg. The maternal mortality rate of Indonesia for the year 2015 was 305. I think this also has mentioned by Alexandra in her presentation as well. This figure is still far from the expected target for the MDGs for 2015, which is 102, and even farther from the SDGs target of 70 deaths per 100,000 live births in 2030. Maternal mortality rate in Indonesia is ranked as the second highest in ASEAN. IPPA data shown that in 2012, 11 to 14% of the maternal mortality rate in Indonesia was due to unsafe abortion, resulted from unwanted pregnancies. Almost half of the women who opted for the abortion at our health clinics have attempted to have abortion by themselves by drinking herbal medicine and also using over-the-counter drugs, which are nowadays are so easy to purchase.
Ibu Koko,
ya.
ada permintaan dari interpreter untuk lebih pelan, Bu.
Oh, okay, ya.
Thank you.
Yeah. The practice of unsafe abortion can be the root cause of maternal mortality problems due to bleeding, infection, failure to remove all pregnancy tissues from the uterus, and many others. Unwanted pregnancy has the potential trigger to mental disorders, especially in the rape victims. In the case of married couple, abortion are carried out because of economic hardship. And this also can be found during this pandemic time as well. Okay, next slide. Results by the Pew Research show that 89% of their respondents in Indonesia view abortion as something that must be opposed. As mentioned before, those 2 million abortions happen in Indonesia, and these figures are actually only the tip of the iceberg. Based on the historical data, Indonesia has provided the safe abortion since 1973 due to the severe effects of the unsafe process. But then this process were also hijacked by the unsafe process due to the high demand and also economical reasons. To these days, because of the cultural, religious, and political aspects, this process are still considered in the gray areas or taboo issues. Everybody are reluctant to deal with these issues. In Indonesia, although abortion is prohibited, this practice is only allowed as long as there is a medical emergency from an early stage of pregnancy, or pregnancy as a result of rape. Next slide, please. Yeah. Based on our experience, there is still tug of wars between views that are pro-life and pro-choice, and it is not surprising that this has a very bad impact on real cases. Current cases happen to a 15-year-old girl from Jambi province in Indonesia that was sentenced to 6 months in prison for an abortion case. The verdict was given by the chief judge of the local district court. The case began when residents found the body of a baby girl in an oil palm plantation. The local police then arrested the 15-year-old girl, and it was found out that her older brothers were her rapists. There are pros and cons of this verdict, but after long controversies, she was acquitted. Okay. Next slide, please. From a formal legal perspective, the Indonesian government are more on the pro-life policy. This is by believing that the process of human life begins to take place since fertilization occurs. As mentioned in the previous slides, there are still tug of wars between these views, and it resulted in the regulations and also the implementation of those regulations. The pro-abortion views can be traced in the health law number 36 in the year 2009, which stated that the government is obliged to protect and prevent women from abortions that are low quality, unsafe, and irresponsible, as well as contrary to religious norms and statutory provisions. In other regulations, the government regulations number 61 in the year 2014, concerning reproductive health, the government guarantees the health of mothers of reproductive age so that they are able to give birth to a healthy and quality generation and reduce maternal mortality. In the ministry regulations number 3 in the year 2016, concerning the management of safe abortion services, the government also guarantees out safely and with quality by trained health personnel at the request of women through counseling and not prioritizing costs. And for the cons, that also it guarantees women who have safe and quality abortions. This policy has also a point that is not in favor for women, especially in the health law number 36 2009 in paragraph 1, which stated that abortion is prohibited. And then in paragraph 2, except for medical reasons and rape only can only be done within 6 weeks, where the definition of healthy can be used as a support for medical reasons, not only physically, but also socially and mentally. And what about the case of IPPA? Okay, next slide, please. Despite of all the pros and cons, IPPA has established a policy that regulates basic principles of safe abortion services, such as mechanisms and methods of service, requirement for gestational age up to 10 weeks of age, and many others. And also IPPA has the policies of providing safe abortion services for women with unintended pregnancies. And our clinic are quite well known on this approach. This is intended to regulate IPPA clinics to implement the same policies and service standards. IPPA also issues supporting policies to ensure service providers to have a clear protection scheme, such as by conducting risk management, quality control, and also advocacy. Okay, next slide, please. So these are the method and also services that provided by IPPA, which also in accordance with the regulations from WHO and also IPPF standard. Okay, next slide, please. Okay. To date, IPPA has 23 clinics throughout Indonesia, yet some of the clinics are not providing safe abortion services due to religious and also cultural issues. One of the alarming findings of the data collected by IPPA is that most of the clients has conducted the procedures by themselves prior coming to IPPA clinic. This shown that once again, women becomes the victims of the situations. Okay, next slide. In other aspects, IPPA has also initiated various research as the base of our decisions. And these are some examples of our studies on these issues. It can be said that there are limited research on these issues. And unfortunately, many of the research has bring controversies in the communities, as many of them are not prepared with its result and find it quite shocking. Next slide. In these 64 years of our existence in Indonesia, our challenges in providing safe abortion services are the following. From the regulation issues, the health law number 36 in number 36 in the year 2009 has made it impossible for IPPA to providing abortion services, and the regulation stated that abortion services must be under 40 years for rape case. And based Based on our data, the average of client using our services at IPPA is over 6 weeks. And also approaches by other institutions put more challenges in our processes. And in many cases, victims are treated as bad as the culprits. The other issues is the rise of the religious fundamentals. Because of abortion services are still considered contrary to norms and religions for many, the provisions of services at IPPA is considered to be against religious rules and needs to be stopped. I think this also applied on the global cases, as where IPPA has pressures from those who seek the pro-life approaches. Another issue is also the low awareness of the government regulations concerning reproductive health, as most of the health providers do not know that there are rules that allow them or regulate the provision of safe abortion services. So providers assume that if they support or facilitate abortion services for any reason, they can be imprisoned. There are still also contextual discrimination in the regulation of the Ministry of Health, especially number 3 in the year 2016, such as for the unmarried status, because in the regulation, client must have a permit from the husband. And also for the case of pregnancy in the rape, which I have mentioned before. Another issue in providing the safe abortion process, IPPA clinic has also been stigmatized and also discriminated. IPPA has a long way in providing awareness that our most concerns are the welfare of the women or the youth and not on the economical issues. Okay, next slide, please. How we move forward with this condition. As the eldest civil society in Indonesia, IPPA has several approaches. For the advocacy level, IPPA has conducted advocacy in these issues by guarding the proposed regulations for abortion issues, and also the bill on the elimination of sexual violence, because it concerns forced abortion, encouraging the government to be able to implement government regulation that are concerning reproductive health. And another regulation that appointing health service facilities as providers of safe abortions. Even though we have the regulations, but in real life, there are no designated service facilities. IPPA has also worked together with anyone or any other institution with the same issues and concerns. IPPA has established networking with the National Criminal Court Reform Alliance to oversee the proposed regulations for issues of education services, especially advocacy for abortion. It is hoped that women's organization can join this network to support the safe abortion policies in Indonesia. And one thing that's important is how we connect together with all kind of aspects, as Alexandra mentioned in her speech, that we have to set up a network regionally. Thank you so much, Alexandra, for reminding us to be connected in those aspects. And on the grassroots level, IPPA has programs that targeted in strengthening and empowering the community, especially the marginal community from teenagers, 10 to 24 years old, how to strengthen their capacity in sexual and reproductive health education, including understanding sexual and reproductive health rights. This proved to be very useful in preventing sexual violence and also to prevent unintended pregnancies. Women, including mothers and adolescents, have the right to safe and quality abortion services. And also using the digital advantage to reach out the a more broader communities. And for internally, IPPA has also conducted capacity building, especially for our clinics, how to strengthen the values, competencies, and skills on abortion, refreshing training for safe abortion services, and how to conduct advocacy for the safe abortion issues. And I would like to conclude that IPPA was still in the journey for removing the barriers to abortion services. And we believe that this issue should be tackled together in the regional stages. As Alexandra has mentioned, is how to create an enabling environment for safe abortion. IPPA committed in protecting the women and even girls' right to through safe abortion. Restricting abortion will not stop the abortion, but will only make matters worse. Let's work together to tackle these issues. Thank you so much. I'll give back the floor to Mbak Vita. Terima kasih, Mbak Vita.
Thank you, Ibu Koko. I really like the closing statement. It's such a spotlight that we cannot work alone in this journey. It's not the journey of IPPA alone in the country, but also the journey of civil society. And for the course of my life, I witnessed how IPPA have been the role model of civil society and women's movement in Indonesia. It has been the womb of many activists who are still consistently organizing communities, influence decision-making, and mobilizing support. Me, myself, I will not be here without IPPA. So gratitude to all IPPA volunteers and activists who have been doing participating in the struggles for 64 years. And I would also like to highlight the first slide of Ibu Koko's presentations. Unintended pregnancy coming from different situations. It is mistimed pregnancy, it is unplanned pregnancy, and it is also unwanted pregnancy. And we have to be able to see how the mechanism we created in the civil society, but also by the government, able to meet the situations that are faced by women and, of course, their families and society. Have we been able to create a policy or a systems that really woman-centered, really putting the rights of women at the center of this policy and practice, or are we still not there yet? And it has been years, I think, and although we see a lot of winnings, but also some drawbacks over the years. But I'm looking forward to see how we as a civil society holding hand with the government to really advance what we have been seeing now, transforming the challenges and into opportunities. So talking about mobilizing support, we have the next speaker, Samara. So Samara's full name is Seda Samara, but she likes to be called Samara. She's joining us from Dhaka, Bangladesh, if I'm not mistaken, Samara. So Samara has long-standing experience in innovative campaign. This is a very timely topics for all of us, especially during the pandemics. We have to be able to see other options when we're not able to meet face-to-face, having online conversation, dialogue, although understandably it is very difficult to have a reflective and critical discussions virtually. But maybe we can learn from Samara's experience on how we are able to create such a process where everyone is willing to be participating in the movement for gender equality, especially unintended pregnancies issues. So Samara, you are welcome to take the mic.
Thank you. Thank you so much. Thank you so much for having me here, firstly. It's been very interesting to hear about everyone's very diverse opinions and the different kind of expertise that everyone brings in. So my name is Samara. I work at She Decides. She Decides is a global political movement. It's an open movement that anyone can basically be part of, and we work on sexual reproductive health rights and bodily autonomy. I support the movements in the Asia region. Currently, we have movements in Bangladesh, in India, in Nepal, and in the Philippines. And we had some conversation about starting up with and that hasn't transpired yet, but basically if there is a group of people, group of individuals or organizations who are interested in starting off in any place around the globe, we would be supporting them. Myself and my team, we would be supporting them. So I am part of She Decides Support Unit, and yeah, so that is my background. I am also part of a local organization here based in Bangladesh called Bonishika. Bonishika works specifically with theater and arts and basically using to raise awareness on gender stereotypes and gender biases. So like one of the previous speakers, because we were talking about global challenges, I would like to concentrate on abortion mainly, because that is what kind of it leads to, and that is what we should have access to safe abortions while talking about unwanted pregnancies. So firstly, I think it's important to realize that abortion laws vary very largely in different parts of Asia. And Asia is in that way kind of a dynamic continent, because when we think about Europe or when we think about Africa, there are certain similarities, but Asia is quite dynamic in that nature. And for every current country as well, abortion laws vary. So for example, it was said some time ago that abortion is legal in South Korea. But if we think about other parts of Asia, it still remains illegal. In the Philippines, for example, abortion has been banned entirely for over a century. The law mandates prison terms of up to 6 years for people who have had abortions and for anyone who assists in the procedure. In practice, abortion is allowed in cases where the pregnant person's life is at risk, but no law explicitly states this. Nepal legalized abortion in 2002 in response to advocacy efforts that emphasized the high rates of maternal morbidity and mortality attributes to unsafe abortions. The law permits abortion with the consent of the pregnant woman for any indication up to 12 weeks. And in last year, in 2021, it was made to be, for now, up to 28 weeks. In Bangladesh, which is where I am from and currently reside in, abortion is not even a term that is used in everyday conversation. It's called menstrual regulation. And so the law in Bangladesh permits regulation for up to 12 weeks of pregnancy. And the method that is used is vacuum aspiration if a woman misses her period. And this was introduced by the government in Bangladesh as part of a family planning program. And it's not considered as an abortive measure. It may be regarded as a euphemism for early pregnancy termination. I sort of wanted to kind of give a global context, or rather a regional context, to spotlight on the challenges that exist even today. And there's a lot of structural barriers about access to resources and information that were mentioned, but I would like to focus more on stigma, on the stigma that is associated with abortion, why and how talking about abortion and talking about unwanted pregnancy still remains quite a big issue, a taboo in our society, particularly when thinking about Asia. And then bringing in young people in the picture, right? For young people, it is even more difficult. We have been so far, I think what was being mentioned was more about women, but it is also necessary to think about marginalized communities, about sexual minorities, about the LGBT community as well while talking about abortion, because the more we're marginalized, the more lack of resources we face in the process. There's more taboo associated, there's more stigma associated. So while talking about abortion and about unwanted pregnancies, I would like to focus on three things. One, first and foremost and most important would be removing stigma. Secondly would be to be able to tell our stories, without any kind of backlash, without any kind of fear, without any kind of thinking about what I might face, what the repercussions would be. And then for mass awareness, I would focus on campaigning, and that is, Peter, what you had asked me to speak about. I was asked to speak about packaging issues to the public, and I think while packaging issues to the public, to start with from ground zero, I think it is very important to talk about it openly, to be able to say how a person's life, a woman's life gets affected in the process when she faces unsafe abortion or when she does not have the resources available to her, what kind of repercussions that might entail, what kind of mental and physical kind of effects it has on a person when that happens. When we think about campaignings, I think it was mentioned briefly, but I think how social organizing, organizing using civic space is again a right that needs to be used more and more, that again in many of our countries we don't have the right for. It is illegal in many countries to organize in public spaces. And I think that again is a mandatory right that needs to be given to all citizens, irrespective, so that we're able to talk about our bodies, so that we're able to talk about all of the injustices we face and all that we need in order to speak freely and do the work and continue the work that we do. Again, for social media, I think COVID has taught us in new ways how we can organize using social media, using Facebook and Instagram, for an instance. I'm also part of another coalition called Feminists Across Generations. We started last year, actually, during the pandemic, and what it has mind-blowingly shown us is that how the power of social media led us to organize. It was only through word of mouth. It was only through social media, through Facebook particularly, that we came about, and we got hundreds, and I think it was 500 people together to start an anti-rape movement in Bangladesh. In Dhaka particularly to start off with, but then it flew to other places as well. But during the pandemic, we saw that domestic violence, which is another very important issue that COVID-19 has shown us, that domestic violence and gender-based violence has become a shadow pandemic almost. And so we started that movement, and it really grew with time, and it was all the impact of social media. So I just wanted to mention that. At She Decides, what we have also been doing is we work with champions. Champions are basically the voices of the organization, and we have young people, and we have leaders, we have ministers, we have heads of NGOs like Plan International and many others actually. So we have champions, and then we have movements. Like I said, I support the Asia movements, and then we have young people. We have two cohorts. There's the ICPD cohort and there's the Generation Equality cohort. So we have 50 young people who are also the voices of the organization. And so through them, we take on Instagram, we do live streaming, we share posts about them regularly and what their opinions are, so that young people's voices are no longer marginalized or tokenized, so that it is led by young people. So that is something that we try to do at She Decides. What we also do is we use art and activism and kind of combine it together. This has been something new that we worked on again during the pandemic. So we work with artivism, we call it. And I'm just going to throw in a link in the chat box if you all can look at it. So this was basically a virtual art gallery that we did during Generation Equality Forum last year. And so, so we basically got a lot of artwork that was talking about body autonomy and sexual reproductive health rights. And this art gallery it's on our website. It was also showcased during Generation Equality and in other places as well, but with other, you're most welcome. And with many other campaigns that we have been running through She Decides, we focus on art, both creative writing and artistic means, paintings, photography, etc., to be speaking or to start conversations about bodily autonomy and SRHR. I would like to throw in some I wouldn't call it recommendations because I don't think I am at that level of expertise where I can give recommendations, but some things to consider maybe when we talk about unwanted pregnancies and abortions. Firstly, I feel like it needs to be said outright. We want safe abortions. We want access to safe abortions, whether without using euphemisms, it just needs to be called as it is. Secondly, we need to have an intergenerational focus. So a lot of the times what happens is that young people are just brought into some discussions and there would be one young person represented in in global and national platforms, but it actually truly needs to be intergenerational and intersectional. So again, if I think about the platform today, it's a great platform. There's a lot of learning, but if we think about other intersectional groups, disabled groups, the LGBTI community, maybe that representation has been missing as well. So maybe think about that. And this is for all of us, and it's a constant learning, right? We do and we learn. Thirdly, having a feminist lens while looking at policies. So a lot of us would be brought into many different discussions on policies, and we would be asked for our suggestions. And a lot of the times what we do, even I do, is that we limit ourselves and we'll ask for very little, so that not to offend government officials and not to offend people within the hierarchy. But I think when we should be asking for the most, because we know that we're going to be getting a lot less than that anyway. So asking for the most and actually using our feminist lens to analyze the policies, each and every policy that we have, even in my country, and we still have colonial laws. So there's a long way to go forward with that. If we think about rape law, and even how rape is defined in most of our countries is very problematic. So we should be asking for the most and working towards that. It is also, I feel, very important to find your people, to find people who are passionate about working on the same things as you are. So if I am passionate about working on gender-based violence, I know that there are other people like me, and there will be those people at every layer. There's going to be those people in the government, there's going to be those people in the CSOs. But if I am an activist, and I am an activist, I need to find other activists like me who will be working on the same issues with the same passion as me and organize. I think self-organizing and finding groups to organize with is key. Of course, it's important to be present and to participate in global platforms, the UN, etc. But I think what is key is self-organizing and grassroots organizing, because that is where the work actually happens. I feel like it's also very important to spell out that abortion rights is a basic right. It's a basic fundamental right, and it's a human's right issue, and it needs to be treated as such. Just like having food and shelter and clothes, abortion and access to safe abortion is a basic human right. I would just like to end by saying two things. One is that I own my body, just like everybody else in this room and in this planet, and everyone should be able to speak about their bodily experiences, no matter what they are, without facing any stigma. And hopefully more and more platforms can be created where we can come out with our stories without feeling shame and being able to share our stories. And finally, I would like to end by throwing out a question. If it were not women, if it were men who faced issues such as abortion, who faced issues such as pregnancy and unsafe pregnancy, would there still be so much discussions that we are having before legalizing abortion and before having access to safe abortion facilities? So I'll leave you with that question, and thank you so much for having me here. It's been a great pleasure.
Thank you, Samara. There you go. There is a very powerful question to all of us. I think we can use that question to have a discussion later on, but I would like to highlight a few things, very important things, is to make sure that the voice of women and also marginalized communities is visibilized in many platforms, because at the end of the day, they are the one who experience all these challenges, but also opportunities, transforming the opportunities. It's very important to as important as doing advocacy at the UN level and many other regional levels, most importantly is to do organizing work at the grassroots level with women's and also other marginalized groups, because as you mentioned, this is the change happened. And then importance of doing cross-movement organizing, but also same movement organizing, using intersectionality, feminist perspective, and also decolonization's lens when we are digesting all these policies that related to unintended pregnancy, abortions in the country. All right, so we have all the panelists presenting their opinions and their experience. Now we would like to also share, hear from the audience. I think we agree that all of us are the experts in our own field. So these three panelists are opening the path for us to having reflective dialogues and how we can transfer all the challenges into opportunities in the next years. So I think we have 1 hour. I would like to confirm to the committee for the discussion, or 30 minutes. Yeah. Oh, I was informed that we would like to hear also opinion from Dr. Tubagus Rahmat Santika Hasan, responding to the presentation by Samara, but also Alexa, and how this presentation they have shared with us resonate with what's going on in Indonesia. Pak Rahmat is the Vice Chairman of IPPA. The mic and space is yours. Thank you.
Thank you, Vita and moderators and all speaker, Alexandra, Bu Koko, dan Seda. Assalamualaikum warahmatullahi wabarakatuh. I want to speak on Indonesia, and I hope speaker can translate my speech. Mohon dibantu, panitia. Dari pembicaraan ketiganya tadi disampaikan bahwa unwanted pregnant ini di Indonesia disebutnya sebagai kehamilan tidak diinginkan. Kalau di dalam keselamatan pasien kita sebut sebagai kejadian tidak diharapkan, gitu ya. Nah, jadi saya pribadi kebetulan mengikuti sejak Beijing Platform sebagai Deputy Child Protection di kantor Menteri Pemberdayaan Perempuan. Jadi improve dalam persoalan-persoalan ini. Mohon dibantu ini ya, sudah screen-nya. Saya coba tadi. Sorry. Dibantu panitia kalau tadi tidak salah. Tadi, Bu. Sebentar.
Sudah bisa, panitia?
Tolong, bentar ya, saya buka saja. Tanggapan, sorry, tadi sudah disiapkan.
Minta tolong dibantu.
Ya, oke. Sudah terbaca ya?
Oh ya.
Oke. Saya akan sampaikan tanggapan terhadap ketiga pembicara di dalam acara Hari Ulang Tahun PKBI ke-64 tahun 2021 ini. Juga pada kesempatan ini kami ucapkan selamat Hari Ibu, Mother Day for Indonesian Women, tanggal 22 Desember tahun 2021 untuk seluruh wanita, terutama ibu-ibu di Indonesia. Lanjut. Slide berikutnya. Nah, yang pertama bahwa unwanted pregnant atau kehamilan tidak diinginkan, ini kejadian yang tidak diharapkan, masih menjadi masalah global, regional maupun nasional, termasuk juga di Indonesia. Dari paparan-paparan tadi juga kita terkesan bahwa angkanya cenderung mengalami kenaikan. Dan saya ngambil dari Pak Hasto Wardoyo, Kepala BKKBN beberapa bulan yang lalu, mereka menyatakan bahwa angka rata-rata nasional dari unwanted pregnant itu 17,5%. Memang catatan-catatan di PKBI hanya 10-12%. Tadi Bu Koko sudah sampaikan juga. Dan menurut SKDI, aborsi ini pada usia 15-49 tahun itu sekitar 12% di tahun 97. Sampai hari ini, Bu Eni mungkin dulu di Kementerian Kesehatan, tetap angkanya berkurangnya sedikit ya. dan tampak adanya unwanted pregnant dan berujung pada unsafe abortion. Kenapa demikian? Karena mereka kan dilarang di mana-mana, tidak bisa melakukan sesuatu, sehingga layanan-layanan safe abortion ini agak sulit dilakukan. Walaupun demikian, dokter-dokter kebidanan Indonesia sudah melakukan penelitian, ternyata unsafe abortion itu menyumbang 10-50% aki. Saya dapatkan dari Dr. Dr. Ovi dari POGI ya. Dan di masyarakat Indonesia, mohon maaf sekali, sampai hari ini tindakan-tindakan unwanted pregnant maupun aborsi itu merupakan hal-hal yang sangat dilarang, sehingga ibu hamil tidak menginginkan kehamilan, hampir sebagian besar lari ke tenaga yang tidak kompeten untuk melakukan aborsi, dukun ataupun bidan, karena bertentangan dengan agama dan peraturan perundangan. Jadi bersembunyi di bawah tangan. Ya. Lanjut. Kita paham semua bahwa komitmen global yang tadi juga banyak disampaikan, sejak sidang umum PBB tahun 79, itu disepakatinya konvensi tentang penghapusan kekerasan terhadap perempuan CEDAW dan dicanangkan di ICPD tahun 94 di Mesir ya, maupun di Beijing Platform di tahun 95. Saya ikut keduanya sebagai anggota DPR saat itu dan sebagai deputi. Kemudian Indonesia pun meratifikasinya dalam Undang-Undang Nomor 7 tahun 84, dan dalam pelaksanaannya ternyata agak sulit. Ya. Kami merasakan sulitnya memenuhi semua hampir hak-hak kesehatan reproduksi perempuan itu. Contohnya saja hak tentukan saat punya anak, jumlah interval dan sebagainya. Ternyata eksploitasi anak oleh keluarga banyak sekali terjadi karena mereka diminta untuk kawin muda di bawah 15 tahun, kemudian punya anak, jadi TKW, anaknya dititipkan ke neneknya. Ini kami sudah menemukan di 117 korban trafficking yang kemudian dilihat di 12 kota, terlihat nyata semuanya. Jadi sama tadi mendukung apa yang disampaikan Bu Koko maupun apa yang harus kita lakukan. Kemudian juga mendapatkan pelayanan kesehatan reproduksi ini juga agak kesulitan. Karena apa? Karena memang ketika ada kehamilan di luar nikah dan sebagainya pasti ditanyakan, dan aturan kita hanya untuk korban perkosaan yang boleh melakukan itu. Walaupun di sananya adalah dulu menstruation regulation atau untuk kegagalan KB dulu bisa dilakukan ya. Nah, jadi intinya memang mohon maaf bagi kami di Indonesia dan mungkin juga tadi desakan-desakan komitmen global itu kami sudah sepakati, tetapi ketika masuk dalam internalisasi kami mendapatkan tadi Pak Alexander menyatakan ada stigma-stigma, ada culture, ada religions ya. Nah, sehingga wanita untuk mendapatkan pelayanan kesehatan reproduksi yang baik itu, yang sehat itu masih jauh dari harapan. Demikian juga komunikasi, informasi, edukasi terus-menerus kita lakukan, dan aktivitas seksual tanpa paksaan dan diskriminasi kekerasan ini banyak terjadi di akhir-akhir ini. Malah kami sedang juga berjuang di parlemen untuk mengesahkan undang-undang anti kekerasan. Telah disepakati termasuk kehamilan yang tidak diinginkan, namun dalam pelaksanaannya sulit untuk dilaksanakan karena berbagai sebab, terutama agama dan culture. Sehingga menjadi satu fakta antara kenyataan dan impian yang sulit diwujudkan dalam hal ketika PKBI sebagai civil society ya, masyarakat sipil, untuk mengembangkan apakah pro-choice atau no-choice terkait dengan budaya peraturan negara agak dinding yang kuat ya. Lanjut. Satu lagi. Nah, bagi Indonesia secara peraturan perundangan, kita sudah masukkan dalam Undang-Undang Kesehatan Nomor 36 Tahun 2009, Pasal 4 menyatakan setiap orang mempunyai hak sama memperoleh akses kesehatan dan memperoleh pelayanan kesehatan yang aman, bermutu, dan terjangkau. Dan di dalam pasal 7172 berhak menjalani kehidupan seksual yang sehat, menentukan kehidupan reproduksinya, dan bebas dari diskriminasi. Itu kata-katanya jelas sekali. Dan terbebas dari paksaan, kekerasan, dan menghormati nilai-nilai luhur yang tidak merendahkan manusia sesuai dengan norma agama, dan diterapkannya peraturan berupa PP, Permenkes untuk mengatur sedemikian rupa. Terakhir, Peraturan Menteri Kesehatan RI nomor 21 2021 tentang penyelenggaraan pelayanan kesehatan semasa sebelum hamil, masa hamil, persalinan, dan masa sudah melahirkan, termasuk di dalamnya pelayanan kontrasepsi dan pelayanan kesehatan seksual. Dan mungkin di sana juga kalau didetilkan ada persoalan-persoalan untuk mencegah maupun melayani korban daripada unwanted pregnant ini ya. Pentingnya asuhan prakonsepsi tujuannya meningkatkan kesehatan calon ibu dalam upaya menurunkan mortalitas mobilitas ibu dan bayi baru lahir. Alhamdulillah tahun yang lalu, bukan tahun yang lalu, baru beberapa bulan ini ya, kalau tidak salah Juni kemarin kita sudah mempunyai peraturan Menteri Kesehatan yang lebih detail. Nah, kemudian pentingnya untuk mengkampanyekan pencegahan unwanted pregnant dan pemberian komunikasi, informasi, edukasi yang jelas sekali kepada kaum muda merupakan hal-hal yang harus kita canangkan segera. Termasuk di dalamnya pelayanan screening kesehatan, pemberian imunisasi, pemberian suplemen gizi, dan pelayanan kesehatan lainnya. Kami di Indonesia punya yang namanya e-cohort, di mana asalnya hanya 10, sekarang sudah 14. Pemeriksaan K1, K2, K3, K4, K5, K6, itu yang nomor 1 dan nomor 5-nya diperiksa oleh dokter dan digunakannya USG, termasuk juga di dalamnya mencegah terjadinya kehamilan yang tidak diinginkan dengan mengkampanyekan gerakan remaja genre ya, generasi berencana, dan berencana itu adalah keren. Terakhir satu lagi, karena itulah kehamilan yang bertanggung jawab adalah suatu peraturan di negaranya yang dilandasi agama dan budaya, telah kami kembangkan semua untuk pencegahan seharusnya bisa menjadi jalan terbaik dan diterima secara sosial budaya yang di dalamnya pun mengandung substansi kewajiban memelihara kesehatannya. Jadi jangan minum Fanta sebelum minum Coca-Cola, jangan bermain cinta sebelum tamat sekolah. Artinya tundalah pernikahan sampai umur betul-betul dewasa ya. Malah di undang-undang pernikahan kita sekarang sudah digeser ke angka 21 untuk laki-laki dan 19 untuk perempuan. Asalnya perempuan 16, laki-laki 19. Mudah-mudahan mencegah dan menghindarkan kepada masyarakat luas ini, terutama generasi muda, bisa kita kembangkan dalam kapasitas melakukan pendidikan dan kampanye dalam mencegah terjadinya unwanted pregnant ini. Karena itu setuju untuk menggelorakan kampanye meningkatkan persepsi tentang kesehatan reproduksi seperti yang tadi disampaikan oleh Sheda ya, Samara, Alexander maupun Bu Koko, untuk menggerakkan kampanye meningkatkan kesehatan reproduksi, terutama 10 hak-hak reproduksi perempuan yang telah disepakati secara global. Yang di dalamnya cara-cara menghindari terjadinya kehamilan yang tidak diinginkan merupakan bagian dari pengetahuan pada setiap perempuan di Indonesia, khususnya juga di global, untuk bisa menjaga hubungan seksualnya itu sebagai hubungan seksual yang bertanggung jawab. Demikian, wassalamualaikum warahmatullahi wabarakatuh. Mbak Vita, saya kembalikan.
Thank you. Terima kasih Pak Rahmat atas thank you for the response. Oh, I still activate the interpretation function. Let me just thank you so much Pak Rahmat for responding to the presentation of our panelists. It's very much appreciated. We have sometimes for audience to share their questions, but also sharing the experience again, because we are the expert. All of us are doing different strategies when it comes to unintended pregnancy issues, including advocacy, providing health services, but also organizing communities. So the floor is yours, audience. Please send your text on the chat box. Also, if you are watching from YouTube, please also send the question there, and the committee will let me know if we have some questions coming in. All right. As we are waiting for audience to give questions or comments, I would like to also maybe ask some of the panelists again to understand and share the reflections for the next couple of years. What are the strategies that are more feasible for civil society to take the lead or occupy the spaces? Is it the UN spaces, or is it the grassroots strategies, community organizing, or is it the health service professions, or which one do we think we would like to have more advanced progress? Oh, okay. Before
Mbak Vita,
sure. Yeah.
Mbak Vita, I think for Indonesia cases, if we look at our recommendation, both of the strategies unfortunately has to be implemented simultaneously. Yeah, it should be like a mid halfway for all the approaches. Like we have to conduct the advocacy and we have to do the networking as well, and at the same time we have to strengthen the grassroots levels, especially the marginalized communities, and also as the biggest Muslim country in the world, I think Indonesia we also have face challenges on the social and also religious contextual issues. Yeah, we all know, and I think that would be our greatest challenges, is how to attract from the religious leaders to be more sympathized on our journey. I think for IPPA cases it would be like that.
Yeah, thank you, Bu Koko. That's a very great response. As we have seen the strategy of PPPF, I think all of the strategies should dance together, and we should take roles, like different roles maybe, because maybe we have different passions, expertise, and maybe in the context of our work, we have to also prioritize some of the strategies and let other people to take other strategies based on their experience and expertise. There is a questions coming in the chat. So from Baskoro Art from YouTube, in fact, in my city during the pandemic, many school children dropped out of school and decided to marry under the hands, or at least dropped out of school, which was supported by their parents. The pandemic has also increased the number of early marriages in my city based on the data from KUA. However, there is no data on abortion reported. The question is, there is a significant relationship between early marriage and abortion rate, ? Or even premarital sex in the late teens that accounts for the highest abortion rates. So I would like to give these questions to the panelists. Feel free to respond to these questions.
Can I come in?
Sure.
I'm not absolutely certain if there is a relation between abortion rates and early marriages, but what is important to understand is the harmful effect that early marriages bring to a person, because they are young, their body is not prepared. They not only is pregnancy is an issue, but then if they are then led to, forced to, or have to get abortions, that has very it's damaging on oneself, and many times they're not left with any option, so they have to get abortion. So I think more than understanding the relationship between early marriages and abortions, what is necessary to focus on is the effect of early marriages and how that is very harmful for oneself, and how that is something that we also need to work on. So when we speak about abortions and having safe abortions. I think there's many different correlated issues that come up, and there's so many things that we definitely need to work on when we think about sexual reproductive health rights and gender equality, and early marriages is definitely one of them that we need to counter in whatever way and capacity. Thanks.
Thank you, Samara. Alexa, do you want to respond to this question?
Sure. The one thing that I would like to add on to say is that there is a direct link to lack of access to services, lack of access to services that are acceptable for young people, for instance, and lack of access to information and education. So especially for things like premarital sex, for when women and girls have bodily autonomy, when they're allowed and have information and education and can make decisions over their own bodies, and they're able to negotiate things like consent, when they want to have sex, and when they do choose to have sex, they do so safely. So they're using contraception, for instance. So I think that information, education, bodily autonomy is the key to reducing unsafe abortion.
Thank you, Alexa. All right, there is a very hot topic at the moment relating the penal code that is being discussed by the parliament in Indonesia, and how it will affect the provisions of information, provisions of services in relation to unintended pregnancy. And what do you think, what the panelists think, but also the audience thinks about what should we do as a civil society to make sure that this penal code will not hinder us, or as something that will drag out to the past, really instead of advancing the rights of women to access health services, actually will hinder women and put them into the box of criminal, which is we don't want as a civil society. Any remarks on that? Audience can also share comments.
I think I would like to invite our DE, Mas Eko.
Mas Eko,
yeah, Mas
Eko.
Because yeah, especially with his background, I think he will give an interesting point of view on your question, Mbak Vita.
Sure.
Hello, Mas.
How we dance in this.
Yeah, true.
Pak Eko, apakah Pak Eko berada di sini? Otherwise, we also have some people who participate in the process, I think, influencing the penal code discussions. You are also welcome to share your opinion and also maybe updates what's going on at the discussion at the moment, and how we as civil society can holding hands together to really influence that this will not hinder the access of women to the unintended pregnancy services.
Well, apologize. I was miss a little bit of the question, but giving the context of Indonesia today, we all understand that Indonesia right now facing a legal process where the Indonesian Parliament try to pass the very important draft law. We call it RUU PKS, which is the anti-violence against sexuality. And PKBI and IPA has been part of the coalition of to ratify and also to push the protection against the violence against the woman are taken in a very strategic, how do you call it, position, and especially giving the fact in the past months, we've been shocking by some bad news about how the sexual violence happening in some educational institution, for instance, in schools, in the boarding schools, and then even in the household. But giving the fact, another fact also that there are lots of unreported cases against the violence happening in the household level. We call it in the KDRT kekerasan dalam rumah tangga, which is happening in the domestic violence happening, and lots of them are not reported, and this is also became a concern. So part of the advocacy and then our support to the to Indonesian government and also to the Indonesian Parliament, how to pursue this how to pursue this act against the sexual violence is really really happening in the near future.
Thank you
I
very
don't know
much,
if that answered the question.
That's actually answered the question somehow, because when it comes to sexual violence, there will be victims, which is most of the time women, who unfortunately may have experienced unintended pregnancy. With the current law that we have in Indonesia, there's quite a challenge for the women and also for us as a service providers to accompany women to be able to access the services that she are having the rights to. But there is another legal process that is going on, which is the penal code discussion, the ratification of the new penal code. And it also discussing on the issues of unintended pregnancy, access to safe abortions, and how this will impact further, or maybe even creating more setbacks to the progress we have made in terms of unintended pregnancy services. Do you want to also share a little bit on how we as a civil society, especially IPPA, would like to respond to this process, maybe working with other coalitions in the country?
Well, actually, there is a concern comes to my daily task as the executive director of IPA, is how to bring more understanding and empowering the issue of the unwanted pregnancies and then the unintended pregnancies to the media, to the press world, because I recognize that Indonesian media or Indonesian press is playing very important role also to give a strong base of thought and also basic advocacy also to the many people, especially for the marginalized group, how to defend themselves and then how to fight and how to campaign this very sensitive issue of unintended pregnancy or unwanted pregnancy. So it is is trying now to engage with more journalists and with some journalist association, and we try to make a good communication and coalition how to deliver the issue to be a good campaign for the Indonesian public.
Thank you, Pak Eko. Very important to visibilize the experience of women and marginalized groups to the broader audience, to the public of Indonesia, so we can occupy the spaces where now is occupied by the fundamentalists that really putting women at the corner as the cause of problems, and also marginalized groups. I would like to also invite audience to share their concerns, their experiences on I think on this issue. I think I know some of us in the audience, we thought about this issue all night and days. We really we face with the victims, survivors, who are not able to access the service they need. And as much as we try, these policies are putting very high wall. Maybe this is a safe space, a place if you want to share. I think your opinion, your stories are very important for us to reflect and to identify what kind of strategy we would like to have for the next couple of years. Anyone? If this is an offline session, I would like to put my eyes on someone and ask them to speak. This is the challenges of having virtual seminar.
Mungkin Mbak Heni, penanggung jawab klinik. Ya, Mas Eko ya.
Iya, Bu Koko. Mungkin para direktur daerah, Bu Koko.
Yang di lapangan ya.
Exactly. This is the space where we share.
Silakan Bapak Ibu.
Benar. Iya.
There's a question from Eka. Eka, do you want to speak out instead of me reading it so you can claim your voice?
Yeah, thank you, Kak Vita. And also thank you, the panelists for very interesting presentations. And I have so many insights from this kind of webinars. Now, I just want to share about the gap between the understanding of how we understand the process at the national level when we work in the local. Yeah, for example, as myself, like if I'm not really initiated to update myself about how was going on at the national level and the process at the national level, maybe I'm conscious on how I can contribute to support the work at the national level advocacy. So I think the gap between understanding about the process of advocacy at the national level from the local CSO itself also maybe become an issue of how we can mapping and then building a strategy, how the collective movement can build from the grassroots community. I think that's the point that I want to raising up because because we know that the advocacy itself become a collective movement that it brings the data from the locals, and also locals need to be involved as well at the national level and get an update about how we can contribute to support the process at the national level. And also I want to highlight or emphasize on how young people also become involved in the process because as what the opening speech what the opening remarks say that now the IPPF also emphasize on how young people contribute or involve in order to empowering young people and enjoying their sexual and reproductive health and rights. So I think in this kind of process, we also need to think about how we can build a strategy to involve young people meaningfully at the advocacy process. Especially on the panel code or in order to do some kind of advocacy efforts at local and also national. Yeah, I think I just want to raise my worry about that kind of advocacy efforts, and also maybe there is some kind of trigger to think about a strategy that we need to build or moving forward to strengthen our collective movement. Thank you, Kavita.
Thank you, Eka, for voicing your concerns. I think maybe Eka's voice is representing executive directors, but also volunteers, staff of the IPPA chapters in all over Indonesia. Very often we forget when we are so occupied with the advocacy at the national level, even regional level, we leave behind our sisters, our friends, our colleagues at the grassroots level who having a very significant role in moving forward the agenda, putting on the table and move it up to the national and regional level, and very often we miss when we have this agreement at the national or regional level to share it and discuss it with people at the local level, regional level, with civil society, with women and other marginalized groups. Any other concerns or maybe response to Eka's concerns?
Can I respond briefly to that?
Sure.
I think, yeah, Eka's points are right on point. I totally agree with what she said. I think as young people, as people belonging to grassroots organizations or communities, the best we can do, or as activists, the best we can do is take part in these conversations, to read, to know, and to be part of these conversations, right? But I think the onus is on those with whom the power lies. And in this dynamic, the power is definitely with national organizations and national NGOs. And it is then up to them to make it a point to include diverse voices and to include grassroots community organizers in these discussions, in these platforms. So where there are two parties, the one that is powerful, I think the onus is always with them to let go of power and to be more inclusive. So I completely agree with her. Thanks.
Thank you, Samara, to put the feminist lens on that concerns that Eka shared. Any other concerns from the audience? Or maybe questions, it's not always concerns. Concerns can also be positive, something that you would like to share from your experience accompanying women, accessing services, organizing women and girls.
Ada pertanyaan menarik tuh Mbak di chat dari Pak Abdul Qadir.
Okay, there is a question from Pak Abdul Qadir. Saya pakai bahasa. Arif can translate into English. KTD banyak diantaranya unreported dikarenakan keluarga atau yang mengalami dalam hal ini adalah korban atau penyintas dikarenakan ini dapat menjadikan stigma sosial. Apalagi saat ini di mana medsos menjadi panglima sehingga sedikit terkuak, maka bisa saja menjadi viral, tentunya hal ini menjadi stresor tersendiri bagi korban dan keluarganya. Bagaimana mengendalikan proses ini? Okay. Any response from not only from the panelists, but also from the audience, maybe some experience on how to responding to this situation?
I think it would be interesting if we can learn from Shida or Alexandra as well. So Mbak Vita, if you could translate it, then maybe they could address based on their experience, on their origins.
Yeah. Alexandra, can you follow the question in the chat? And Samara? Okay, the question is
yeah. I think I could help you. Maybe I could help you, Mbak Vita, ya.
Sure.
Like the unwanted pregnancy cases in Indonesia, most of them are unreported because the families or even the victims become stigmatized, especially during this time of social media. If the incidents are leaked on the social media, then it would be viral and it would be a stressor for the victims or the families. So how we could address this? Do you have any experience on this? How social media can become how to say that, a negative force in those kind of incidents? Begitu ya Mbak Vita, benar ya?
Betul Bu. Yes.
Siap, silakan.
So, Samara and Alexa, do you have any experience on how to deal with this context when social media is actually a negative force for these rape victims?
Alexandra, do you want to go? Or do you want me to?
I can answer briefly. I think that you are better placed because I work more at regional level, so I don't have a lot of direct experience. But I do know that key to addressing this is making sure and enhancing capacity of people at grassroots level to know what their rights are. and understanding more about bodily autonomy, more about sexual and reproductive health and rights, and addressing stigma that way. The other thing is that there's a lot of great digital initiatives out there which are defending, and I can see you nodding a bit, they're defending SRHR. So there's platforms, I know there's organizations and young people in other countries using things like TikTok to share positive experiences and kind of create a more acceptable environment to share about your experiences. So TikTok, Twitter, I don't use TikTok, I'm not very familiar with it. So I think the young people on this, in this meeting today can maybe share a little bit more about it. But using all of these digital innovations for positive sharing of experiences is a very powerful tool.
Thank you so much. To add to that, I think I would just like to say that there's, as I was saying at the very beginning of my presentation, there's a lot of stigma and taboo attached to women, to sexual minorities and their bodies, and us being able to speak about it openly and freely. So I think the stigma needs to be removed first and foremost. When we start speaking about our stories, both positive and negative, and there's more campaigns, there's more done on social media to create those safe spaces, I think more and more women can come out and speak about it. As a society, we are also very prone to blame the victim. So there's a lot of victim blaming and slut shaming that happens on social media. And when there's more said about it, when people who are working on the arena come forward and speak up about it, and when there's, irrespective of that, I know it's hard, it's difficult, but when there's still more women who come up and speak about their experiences, then there will be others who are motivated and can feel safe to talk about the same. So I think that's the only way to go, to have more campaigns, to have safe spaces where we can talk about our issues and our experiences, and to raise children and to raise a society that respects one another, irrespective of what gender they are and where they're from and what the color of their skin is. Thanks.
Thank you, Seda and Alexa. Very comprehensive response.
Masih di mute, Mbak.
Sorry. Thank you, Alexa and Samara, for the comprehensive response, but also maybe we would like to hear from the audience. I know I work with a lot of IPPA chapters. They also have the experience of dealing with this case. And this is a very great opportunity to share your lesson learned to the others.
Mbak Heni, ayo Mbak Heni sharing lessons learned from PKBI, Mbak Heni.
I love Bukoko is helping me pointing out people.
I'm the stressor here.
Mbak Heni, please.
Yeah.
Thank you, Mbak.
Iya. Terima kasih Bu Koko, terima kasih teman-teman juga. Untuk bagaimana kita mengendalikan medsos yang saat ini banyak yang benar dan ada yang benar dan ada yang tidak juga. Nah, PKBI di beberapa daerah dan juga di nasional itu mengadakan pertemuan-pertemuan, training-training dengan para jurnalis untuk memberikan pendidikan isu tentang kesehatan seksual dan reproduksi, termasuk aborsi yang benar. Jadi di sini semua masyarakat banyak yang juga tidak tahu bahwa aborsi sebenarnya legal restricted seperti itu, dan juga ada aborsi aman dan tidak aman. Nah, mungkin di lokal kami di lokal ini perlu juga untuk mengisi, mendukung untuk push di level nasional juga ikut memberikan pendidikan kesehatan seksual dan reproduksi, termasuk isu-isu aborsi ini kepada masyarakat dan anak muda, yang mana anak-anak muda ini senang sekali membuat konten-konten di media sosial seperti itu. Nah, juga kami juga di pusat juga teman-teman di komunikasi juga melihat konten-konten yang mana jika kemudian itu tidak benar, kami juga menghubungi dan kemudian menginfokan ya kepada yang membuat medsos itu jika memang tidak benar. Itu Kak Arif untuk yang media sosial. Nah, mungkin untuk yang tadi dari Eka Puri, bagaimana CSO bisa berperan. Nah, CSO atau teman-teman lokal di daerah, di pusat saat ini tim advokasi sedang berjejaring dengan CSO lainnya untuk mengawal RKUHP terkait dengan isu aborsi. Nah, di beberapa pertemuan bahwa data-data ini seharusnya sangat mendukung untuk advokasi. Nah, ini dilaporkan bahwa di Indonesia seringnya tidak ada data aborsi yang terlaporkan benar seperti yang disampaikan Pak Salim di dalam chat, bahwa jarang sekali hampir tidak ada data aborsi yang terlaporkan. Nah, ini momen sebenarnya untuk PKBI, terutama saat ini kita sedang fokus di undang-undang penghapusan kekerasan seksual, di mana sebenarnya poin kuncinya untuk kehamilan yang tidak diinginkan kita bisa mulai dari kasus-kasus aborsi karena perkosaan. Nah, ini limit sekali, bahkan pada saat pertemuan dengan di level nasional juga banyak CSO yang tidak mempunyai data terkait perkosaan. Nah, ini diperlukan dari anak-anak muda mungkin bisa berpartisipasi, kemudian untuk bisa memberdayakan remaja apabila mempunyai data-data itu bisa dilaporkan, mungkin dilaporkan pada pendampingnya. Dan kemudian mungkin di level klinik di mana PKBI mempunyai 23 klinik dan 8 non klinik ini juga bisa menyediakan data-data terkait data perkosaan. Nah, jika kemudian ini bisa dikolek di nasional, ini menjadi modal yang besar untuk PKBI bisa mendorong advokasi terkait kasus aborsi ini. Setidaknya seperti yang diinginkan masyarakat adalah bisa mengakses aborsi yang aman dan bisa kemudian pemerintah bisa menyediakan fasilitas yang ditunjuk, yang mana dari tahun 2016 peraturan Menteri Kesehatan ini hadir, sampai saat ini pun belum ada fasilitas yang ditunjuk. Mungkin seperti itu Kak Arif, pengalaman di nasional. Terima kasih.
Thank you, Mbak Heni, for sharing the experience of IPPA at the national level, based on, of course, the learning of IPPA chapters in all over Indonesia. You really highlight the importance of working with journalists because they are the spokesperson of the public. They have the power to either capture positive news about SRHR issues, or rather they capture the most bombastic but not really surfing the rights of women and girls and other marginalized groups. Is there any other question, concerns, sharing from the participants in the Zoom or YouTube, or any response?
May I add some points to the question regarding the use of social media and the issue of this unwanted pregnancy, Vita?
Sure, please, Paiko.
Yeah, basically, we all have to expand our knowledge about the general health issues, especially on the sexual reproductive health rights issues, before we give a certain response to any post or any aspiration coming from the social media. This is very important because in the social media there is a very basic character that we cannot really control what is coming in and what have to what we have to be pick up and what we just leave. So it is very important for us to have a basic understanding about the issue of unwanted pregnancy and sexual health and reproductive rights, especially something that we can give more positive feedback to the public, especially when there is a strong stigma against the practice of safe abortion, for instance, and it's been lots of bad campaigning about how the woman should decide their rights, what is the best for their life, for their bodies. And the other things is also very important for us to how to distinguish, or how to how do you call it, to recognize which type of social media that used by the public. Because every social media has their own follower and has their own style of platform. If we see the Facebook or Instagram, Twitter, it's used mainly used by different kind of group of people. Facebook usually used by the public my age, like between 40 to 60 years old, for instance. Also similar with Twitter, which is a little bit younger, about this. And Instagram is followed by maybe lots of young generation, age between 18 to 30, instance. So if we can recognize what type of the social media, so we can also learn kind of misconception, what kind of information that the people spread on the social media, and from that part we can use our own tool and our own knowledge to fight the disinformation and the misinformation against the unwanted pregnancy issues. That's from me, Vita.
Thank you, Paiko, for sharing your experience in dealing with journalists, working with journalists, and how important it is to really build the network at the national level, but also at the local level. We are now approaching the end of our webinar. I would like to ask permission from the audience to capture some of the important points from the panelists, but also from the audience that you shared during discussions. I think we agree that unintended abortion, unintended pregnancy is not a standalone issue. It's a social issue. It's an outcome of many social problems in the society. Therefore, to respond to this issue, we require us to have creativity, agility, braveness to work with different actors, power holders, the government, the civil society, organizations that are working, providing services, organizing people, and journalists especially, we discussed earlier. And we, as Bu Koko mentioned also, we have to use all different strategies that will enable us to make the progress we would like to see in the coming years, but really pick the one that you are capable of, you would like to challenge yourself, because it is impossible for us as an organization or as an individual to do all of these things. It's also allowing other people to take the lead and involvement in the movement. So making the movement is larger, intersectional, including with young people and other marginalized groups, because this is not only the issues of women and girls, but also the issues of marginalizations, operations of the civil society. I would like to also highlight that it is important to visibilize the voice of women and girls, and also marginalized groups, into the space, whether it's social media, whether it's policy, or capacity building, but have to be careful in how we pick our fights and where we pick our fights. Make sure that we have support system that will cover us when there is something unwanted or intended happening to us, and believe that, you know, when we are in the movement together, we're holding hands together, hopefully we will be able to see change that we would like to see in the coming years, because we hope when we meet again next year, there's something we can celebrate as an outcome of the hard work we have been doing in the grassroots level, but also at the policy level. So with that, I would like to thank everyone, thank the panelists, thanks the audience for sharing this session with me and all of us at the committee. Gratitude to PKBI, IPPA Indonesia for standing strong for 64 years in the movement. I would like to give it back to the MC. Thank you.
Oke. Ya, terima kasih Vita.
Yang luar biasa.
Luar biasa. Dan juga mungkin
highlight sedikit
ya. Tadi ada sebagian besar membahas tentang kendala yang akan terjadi terkait dengan aborsi aman atau unwanted pregnancy, terkait dengan RKUHP, ada juga mengenai RUU penghapusan kekerasan seksual, lalu belum adanya penunjukan klinik untuk fasilitas korban fasilitas untuk korban kekerasan seksual dan juga indikasi kedaruratan medis sampai saat ini. Wah, seperti itu. Dan perlunya mengenai keterlibatan remaja dalam mengkampanyekan isu HKSR yang saat ini terutama yang berkaitan dengan unwanted pregnancy. Seperti itu sih highlight-nya yang aku tangkap. Luar biasa sekali perbincangannya kita ya pada pagi hari sampai siang hari ini.
Ya, aku yakin ini teman-teman semua di daerah juga punya banyak informasi baru ya, insight baru juga yang berkembang seperti yang tadi juga udah disampaikan oleh Alexa gitu, bagaimana sebenarnya ada peran-peran platform internasional juga yang dapat kita manfaatkan dan yang dapat juga kita turunkan, dan bisa jadi menjadi mungkin dalam kebijakannya nanti tentu ada prosesnya ya, ketika ini harus dibangun di dalam undang-undang di negara kita dan tentunya diratifikasi.
Tadi ada juga dari salah satu pembicara yang mengatakan bahwa Indonesia bisa ikut dalam pembahasan mengenai UPR.
Ya, UPR ya dari Alexa ya tadi yang menyampaikan hal tersebut, dan ini peran yang besar juga bagi kita di PKBI tentunya, Rizka gitu. Mungkin memang di level kebijakan untuk negara kita sendiri itu butuh proses tentunya yang Rizka sudah memang menjadi kerja pokok kita juga di PKBI ya. Apalagi ini pengampu advokasinya ini ada Ibu Rizkanya di sebelah. Tapi selain itu juga tentunya ini juga baik untuk menjadi penunjang dalam kebijakan kita secara internal juga, seperti itu ya Rizka, yang bisa kita perbincangkan dan memperkuat tentunya nanti bagaimana lembaga kita menyikapi tentang perkembangan SRHR ini, yang tentunya hal ini bergerak karena sosial ya Rizka ya. Ibaratnya ini bukan sesuatu hal yang mutlak yang selalu dalam keadaan seperti itu tidak selalu berkembang, sehingga memang harapan saya sendiri ya secara pribadi, kita memang perlu untuk sangat melek banget nih dengan isu ini, selalu melihat pemantauan perkembangannya, karena ini tidak hanya dari satu sektor, nggak bisa hanya ngomongin tentang masalah kebijakan aja, nggak cukup ya Rizka ya, tapi itu penting. Selain dari situ ya bagaimana kita ngebangun fasilitas seperti yang Rizka sampaikan tadi, bagaimana services yang benar-benar ramah bagi korban kekerasan, bagi orang-orang yang tanpa ada stigmatisasi nih gitu, ketika dia datang dengan problema, misalnya dia aku pun mungkin tidak mau menyebutkan problema ya, tapi ibaratnya dengan kasus unwanted pregnancy ini bagaimana sih seharusnya dia mendapatkan suatu pelayanan yang baik. Belum lagi seperti pertanyaan tadi juga itu Rizka, yang ya benar stresornya tinggi gitu. Ketika itu dia pengen menginformasikan itu, mendapatkan dukungan, malah media sosial juga bisa datang dari sisi positif ataupun dari sisi negatif. Nah, mungkin disinilah letaknya kita PKBI ini mau berjuang dan menggunakan strategi apa tentunya, yang ya balik lagi seperti cerita tadi, ada pengaruh budaya, agama dan lain-lain yang tentunya itu juga tidak dapat kita kesampingkan, tapi tentunya juga tidak menghambat pekerjaan kita gitu ya Rizka ya, dengan koridor-koridor yang sudah disampaikan. Dan Mbak Heni juga tadi mau highlight menyampaikan bahwa segala prosedural yang PKBI lakukan tentunya itu sesuai banget dengan dunia medis tentunya ya. Ada prosesnya gitu yang dijalankan gitu, mulai dari bagaimana klien datang, apa yang dia dapatkan, ada konselingnya gitu, ada hal pre dan postnya yang dia dapatkan gitu, komprehensif, hingga juga kita juga di PKB itu ini juga ya Risa, kita juga punya sebuah program, aku kalau nyebutin program paling ibaratnya juga kita itu menyepakati bagaimana nanti kalau disebut dalam bahasa medisnya mungkin rehabilitatif ya, dalam metode itu bagaimana kita tetap mendampingi nih.
Betul
mendampingi
sekali.
Tidak hanya selesai dalam services habis itu lepas, tidak. PKBI itu benar-benar bertanggung jawab dengan segala tindakan yang dilakukan lah ya gitu. Sehingga ya mungkin Rizka juga mau menambahkan gitu, sehingga tetap ada proses pendampingan yang kita lakukan baik dari proses awal hingga proses akhirnya.
Semoga jika ada penunjukan nantinya oleh Kemenkes, kita bisa ditunjuk ya sebagai salah satu pemberi layanan, karena PKBI sekarang sudah memiliki 23 klinik, belum lagi yang satelitnya yang sudah tersebar di Indonesia, dan sangat ahli dalam bidang unwanted pregnancy ini.
Ya. Dan tentunya juga nggak selesai di situ juga, harapannya kita tetap membangun jejaring ya, seperti saat ini kita juga sudah bersama tadi dengan Ibu Eni dari BKKBN, yang mana PKBI juga sudah punya kerjasama yang baik ya, yang erat ya dengan BKKBN dalam upaya kita bagaimana memberikan layanan yang baik gitu ya, good services gitu bagi klien-klien kita. Dan begitu juga mungkin tugas kita semua di daerah nih, tetap ya jejaring itu tetap harus dibangun dalam segi apa saja, apalagi ketika Samara menyampaikan ya dari CD site itu campaign itu nggak bisa bergerak sendiri. Ya campaign itu strateginya ya kita mungkin lebih baik itu ketika bergerak bersama, sehingga juga tadi Samara menyampaikan program CD site ini juga berlaku di banyak negara gitu ya Riz ya. Dan termasuk di negara kita di Indonesia itu PKBI sendiri juga pernah bergabung untuk campaign ini ya di 2013 dulu secara intensif. Seperti itu kira-kira highlight dari kita nih, kita berdua bisa menguasai panggung lagi nih Rizka ya, bisa panjang lagi ceritanya nih kalau kita berdua ya.
2 jam lagi nih.
Oke, ya mungkin dari kita mau mengucapkan terima kasih
banyak
ya kepada, kita boleh sebutin satu-satu kali ya Rizka ya, tadi ada Samara dari CD Site, kemudian ada Alexa dari Asia Pacific Alliance, kemudian juga ada ada Ibu Koko. Nah, saya langsung menyebutkan Ibu Josephine, atau biasa kita panggilnya Ibu Koko nih. Ibu Koko dari Board of PKBI yang juga tadi sudah menceritakan segala aktivitas yang sudah PKBI lakukan ya Rizka. Kemudian juga spesial juga kepada Bapak Rahmat Santika sebagai boardnya juga PKBI ya, yang tadi sudah memberikan highlight dari semua paparan dari para narasumber kita. Dan kemudian terutama nih Rizka kepada moderator kita nih.
Kepada moderatornya terima kasih banyak.
Alur ya. Pada Vita kita sudah lama tidak bertemu ini. Mudah-mudahan
bertemunya secara virtual aja.
Secara virtual melulu nih. Mungkin next ya kita mudah-mudahan tahun depan COVID lebih terkendali, kita bisa melakukan aktivitas seperti ini secara offline seperti itu. Dan selanjutnya juga kepada ini ya tadi Bapak Ihsan, ada Jamil juga mungkin yang masih bergabung juga bersama kita ya Rizka ya. Dan juga para direktur, Bapak Direktur Eksekutif dan juga Direktur Daerah. Kita berdua
pamit undur.
Ya, tapi sebelum pamit undur, jangan keluar dulu karena kita harus berfoto juga.
Kita harus berfoto bersama sebelum pamit undur.
Kita harus berfoto bersama setelah ini. So, kita invite all participants to open the camera.
Untuk yang konsen saja.
Dan mungkin kita minta konsennya juga ya untuk seluruh peserta bahwa kita akan mengambil foto dan video. Oke, dan nanti panitia akan memandu, akan saya bantu hitung mungkin dari kita ya, menghitungnya nanti tinggal dikode oleh panitia. Dan sepertinya ini ada sekitar 4-5 slide ya, cukup banyak.
Jadi jangan lupa senyumnya tetap dijaga.
Tetap dijaga gitu selama beberapa menit. Oke, kita boleh berfoto bersama, dan panitia mungkin boleh disampaikan kepada saya apakah sudah full dari semua partisipan yang membuka kameranya.
Karena tidak terlihat.
Karena dari depan sebenarnya nggak semuanya kelihatan ya. Oke, sembari kita menunggu panitia memberikan aba-aba,
jangan lupa untuk mengisi daftar absensi.
Data absensinya nanti akan dikirimkan kembali oleh panitia di chat box. Dan kemudian juga kalau misalnya teman-teman semua pengen nonton lagi nih, kayaknya tadi aku seneng banget dengan paparan yang tadi, pengen ngulang lagi, jangan sedih, jangan takut. karena ini akan kita posting ya di YouTube-nya PKBI di @suara_PKBI.
Kita masih menyimpannya di Suara PKBI di YouTube-nya. Jangan lupa untuk ditonton kembali
dan jangan lupa untuk di-subscribe juga.
Oh iya, itu penting.
Kita suruh nonton tapi nggak taunya nggak di-subscribe di Rizka. Jadi
Iya.
kita minta teman-teman kita juga boleh untuk men-subscribe. Oke, panitia, apakah sudah bisa diambil fotonya? Saya mohon bantuannya. Oke, ada berapa slide? Saya boleh dikode dulu. Ada 4 slide. Oke, baik teman-teman semua, saya akan pandu dari sini ya Rizka ya,
Ya.
untuk pengambilan fotonya. Dalam hitungan ketiga itu akan diambil. Ada 4 slide, jadi ada 4 kali foto.
4 kali 1, 2, 3.
Iya, 1, 2 kali. Jadi mohon senyumnya ditahan dulu ya. Oke, baik. Untuk slide pertama saya akan kodekan. Oke, slide pertama udah siap panitia? Oke, 1, 2, 3.
Selanjutnya slide kedua.
Oke, slide kedua. Ready panitia, slide kedua. Oke, saya hitung kembali. Rizka boleh bantu?
3, 2, 1.
Malah lempar-lemparan ya. Oke,
Slide
ya.
ketiga.
Slide ketiga. Oke, saya hitung kembali. 1, 2, 3.
Dan yang terakhir untuk slide keempat, silahkan masih dibuka kameranya. Sekali lagi, 1, 2, 3. Ya, sudah? Sudah panitia semua? Oke.
Luar biasa. Luar biasa, Rizka. Melihat wajah itu saya langsung merasa, aduh seneng, dan semoga ini menjadi energi positif bagi kita semua ya. Meskipun
Dan yang hadir lebih dari 100 orang.
Lebih dari, tadi itu bahkan panitia menyampaikan bahwa udah nggak bisa masuk lagi gitu.
Iya,
Saking
iya.
padat merayap dan kita minta dipindahkan
Dipindah
ke
ke
YouTube.
YouTube saja, betul sekali.
Ya, semoga semangatnya tetap terjaga. Tentunya dalam seminggu lagi kita akan menyambut tahun baru dan harapannya semangat ini tidak akan pudar dan ini menjadi menjadi batu bumerang lagi nih. Amunisi baru nih Rizka buat kita ke depan ya.
Benar
untuk
sekali.
semua pergerakan di program-programnya PKBI.
Iya, aku juga mau menyampaikan selamat Hari Ibu dan juga selamat Hari Perjuangan Perempuan ya, karena awalnya Hari Ibu adalah Hari Pergerakan Perempuan.
Oke, dan saya perlu mengingatkan sekali lagi bahwa besok itu masih ada kegiatan
makasih.
acara puncaknya ulang tahun PKBI yang ke-64 itu juga akan ditayangkan secara live melalui YouTube PKBI dan juga dari Zoom. Jangan kemana-mana teman-teman semua, kita bisa bersua kembali esok hari di jam yang sama ya Rizka, di jam berapa Riz?
Jam 9
hingga jam 12 siang besok hari. Hanya itu kayaknya ya Rizka.
Iya, kami pamit undur.
Kami berdua, saya Nara Efriani.
Thank you very much for the...
Kami mohon maaf jika ada salah-salah kata dan selamat beristirahat dan sampai ketemu kembali esok hari dan tahun depan. Terima kasih.
Sampai jumpa.
Thank you, Alexandra and Samara.
Terima kasih.
Terima kasih semuanya. Terima kasih yang di studio. Terima kasih teman-teman staf KBI. Terima kasih Pak Iksan, Bu Koko.
Semua para pengurus daerah, teman-teman.
Thank you all.
Ya, teman-teman.
Stay safe and healthy.
Ya. Kita ketemu besok ya. Kita ketemu lagi besok.